This is Hope McMillan, and I'm doing scenario 1. Cecilia is a primary care client, a 37-year-old woman here for an ID insertion because she no longer wants kids. Her pre-IUD appointment was scheduled a week ago and the workup was negative for any problems. After the long bus ride to the clinic and after getting up on the table, she starts to have left side chest pain, which feels like a rapid pounding in her chest. With the pain, she rates at a 5 out of 10. The pain radiates into her left arm and feels like pressure. She is somewhat panicky, but has no tingling in her fingers and or around her mouth. She feels mildly nauseated. She developed mild shortness of breath after about 10 minutes of chest pains. She gets slightly dizzy after a few minutes. When asked about her medical history, she has high blood pressure, high cholesterol, and smokes 1.5 packs a day. She is mildly obese and has a sedentary lifestyle. Taking the bus to the clinic was the most exercise she's had in months. She has a history of rapid heartbeat as well as amphetamine use, but none in the last week. She had 2 cups of coffee this morning. She is not a diabetic. Her father died of a heart attack at the age of 50. Her medications include a blood pressure medication and a cholesterol medication. Her pulse was 150. Her blood pressure was 145/5. Her temperature was 98.6. So, now that you brought this client, Cecilia, into the exam room and you're setting up the room for an ID insertion, the lead clinician will be placing the IUD shortly. This is a primary care family planning day in clinic. You notice this client starts to feel uncomfortable because she is having chest pain. Describe all the steps that you would take to appropriately assess and examine this patient's condition. So I would immediately stop setting up for an IUD. I would place her in a Fowler's position. I would make sure and ask her again her pain level to see if it's increased. I would make sure she is in a secure place and position that she cannot fall down. I would ask for help for the closest person and or physician if it was available. I would also call for an EMT. The lack of medication for the couple of days, caffeine, the stress to the clinic was a lot on her. So I personally wouldn't feel comfortable just sending her home. I also don't think it would be a very good idea to insert an IUD while she's not feeling well. So while we're waiting for EMT to get here, I would attend to her. I would retake her vitals and make sure she is not getting any worse.